Today is our 759th Zoom session. For the last 758 days, we are continuously conducting this Zoom session without any break. Today's our guest is Amina Meer from Udupi. And Madam Amina is worked as an RMO and she had presented many papers about the short clinical revision about her diabetes mellitus and about the cases of her diabetes mellitus and anorectal complaints. Today, she is going to give us a class about the rare remedies that commonly used. I am welcoming you, Madam, to our Zoom session.
Good evening, friends. Today I am going to present rare remedies which we commonly use. So all of you, know these remedies. The information about these remedies is available in our source books elaborately, but I am going to present only those remedies which have benefited me, which I commonly use in my practice. As I always say, knowledge and wisdom, if you do not apply, then it goes as a waste. So let me begin with my first rare remedy, that is QUADRFOLIA. You can think of this medicine when there is violent pain on both sides of neck, extending down to fingers, what we usually get in cervical spondylitis. We always think of ruta also in such cases. The condition is aggravated by mental exertion. See, when we are doing mental exertion, naturally we sit in a same place or prolonged sitting in one place, that causes a sort of sprain or a strain on our neck muscles, resulting into pain. When that pain extends to arms, we think of, along with ruta, strontium carp, QUADRFOLIA is one of the medicines. My next medicine is DOLICHOS. It's very often useful for diabetic pruritus or senile pruritus, especially at night time. It's also useful in post-herpetic neuralgia. We can think of other medicines like ranunculus bulbosus, kalmia, and mesarium. VISCUM all. Severe neuralgic pains of sciatica. The pain is described as tearing, shooting pains in both the thighs. THIOSINAMINUM. This medicine acts as resolvent. It helps to dissolve cicatrices, adhesions, strictures, tumors, keloids, corns and callosities, enlarged glands. See, it has been often used in tinnitus. And as you all know, for tinnitus, there are various reasons. But if there is hardening or fibrosis impeding the vibrations in the middle ear, or there are three bones, as you know, hammer, anvil, stirrup in our middle ear. When there is a autosclerosis, sclerotic changes in those bones, or when there is a calcium deposited on these tiny bones, or if there is a thickened eardrum. So wherever there is thickening, this medicine helps to dissolve that. In this case, I would like to present a clinical case which THIOSINAMINUM has helped me. Prior coming to 2 days prior, the patient's brother sent me a message on WhatsApp asking, "Doctor, can you treat psoriasis?" So I told him, yes, we definitely treat psoriasis, but I need to see the patient, I need to examine him. So the patient came from Mangalore, a male patient, 76-year-old, known diabetic since last 30 years, and he was on insulin. 6 weeks back, he has undergone scraping of soles and amputation of last toe. His entire both palms and soles were so thick that when I touched that part, I felt that I'm as if touching a stone. So this case was diagnosed as psoriasis, and allopathically they have given him some creams to use. So stony hardness of the soles, and it was more on the soles than on the palms. The patient came to me on 24 November 2020. Because of the hardness, I started him on calcarea floor 6x in the morning and THIOSINAMINUM 30 at night. I had only THIOSINAMINUM in 30 potency, though I know that it is a pathological changes and the lower potency might help him more, but I didn't have any other potency except 30. And I always believe with our late Dr. Koppikar saying, when you have selected the similimum, the best potency is the one which is available in your medicine box. So I decided to give him calcarea floor 6x and THIOSINAMINUM 30. I gave him a course of 3 weeks. On 16th of December 2020, the patient came from Mangalore for follow-up. Since he was very happy, he didn't mind traveling. 50% of the thickness has vanished. So here, because of his past history of amputation and infection, I gave about 3 doses of echinacea as a base remedy. And again repeated calcarea floor 6x and THIOSINAMINUM 30 for another 3 weeks. At the end of 6 weeks, the hardness, the callosities, the roughness has entirely vanished and the skin was absolutely smooth. So this is the power of dissolving the hardened tissue or the scar tissue in THIOSINAMINUM. USTILAGO. All the dysfunctional uterine bleedings, DUB, what we call, menorrhagia, especially during menopause. Very often the patient comes undergoing DNC and they bring us the report. The report reads endometrial biopsy, adenomatous hyperplasia of the endometrium, bleeding fibroids. In all such cases, you can use USTILAGO. SYMPHORICARPUS RACEMOSA. You all know about its value in morning sickness, persistent vomiting during pregnancy. SOLIDAGO. Defective functions of kidneys, especially chronic nephritis. Retention of urine, either due to cystitis or even in enlarged prostate gland. It replaces use of catheter. It is as well, we can call it as a homeopathic catheter. I have given it in mother tincture forms, 10 drops diluted in water 2 to 3 times daily. So very often catheterization is not necessary. Dr. Gurin Menevilla cured anuria with this remedy. It is traditionally known diuretic in homeopathy. Cholesterinum. It's useful in gallstones, gallstone colic with typical bloating of abdomen, belching, liver engorgement. Here, I had a patient who often used to come with typical bloating of abdomen and belching. So I insisted on doing the ultrasound sonography, but he never listened. He had that fear complex. One of his friends had done ultrasound and they have given a wrong report. So he didn't want to undergo any checkup or ultrasound scanning. So with few doses of China and cholesterinum, he felt much more better. The other medicine I have used along with cholesterinum in these gallstone colics is TAURI, a combination of China, cholesterinum, TAURI, and Cardas marianus. These four medicines, 90% of the gallstones can be taken care of. TAURI, it emulsifies fat and increases the action of the intestines. It liquefies bile and acts as a purgative and cholagogue. It stimulates the contraction of gallbladder. One author in specific therapeutics says, when taken before each meal, not only becomes a valuable remedy during the colicky attack, but it acts as a preventive. EQUISETUM, bedwetting in children. Cystitis and urethritis in patients who are on catheter. In geriatric group of patients, when they are on catheter for a long time, they often get the cystitis and urethritis with typical pain around the urethra and burning sensation. So in such cases, for both cystitis and urethritis, EQUISETUM is one of the best medicines. GINKGO biloba. It is also called as brain herb. It helps to increase blood supply and improves circulation and oxygen tension in parts. Vasoprotective action. See, it can be useful in atherosclerosis, anti-thrombotic action, and anti-ischemic action. Raynaud's disease with typical numbness and pain around the fingertips. So to improve the peripheral circulation in Raynaud's disease. Varicose ulcers. Oozing eczema in old people. Senile pruritus with dry, thick, leathery skin. Ginkgo biloba has got a marked action on the brain. That's why it is called brain herb. Its action on the brain, it improves thinking, learning, and memory. So we can as well use this in children with learning disability, poor concentration, inability to retain the things. So it boosts memory and enhances cognitive performance. So useful in senile dementia and also in Alzheimer's disease. Continuing Ginkgo biloba, as its action on the blood vessels, retinal problems like macular degeneration, glaucoma, and cataract, tinnitus, and vertigo. We can use in erectile dysfunction, in impotency to improve the circulation, altitude sickness because of lack of oxygen, asthma, depression, and disorientation. So this is a herb of immense importance as far as our brain functions are concerned. ACTEA spicata. It's a remedy for piano players. No doubt nowadays there are not much piano players, but we use laptop and mobile users. Overuse of fingers. So when you get the pain in the fingers, especially due to overuse, smaller joints, pain in the smaller joints because of overuse. There is another medicine, strontium carb, when there is lot of overexertion or sprain on the parts. But this particular medicine, ACTEA spicata, we can use for rheumatism of smaller joints of hands and wrists. The other medicines are caulophyllum, causticum, and guaiacum. PAEONIA, useful in painful hemorrhoids, rectal fissures, proctitis, inflammation of the rectum, piles associated with anal itching. The other medicines are aesculus, ratania, nitric acid, sulfur, and HYEMALE. Along with that, PAEONIA also helps in painful hemorrhoids. GUAIACUM. Use this in carpal tunnel syndrome with typical numbness, tingling numbness in fingers. Arthritis relieved by cold applications. Generally, you see that most of the arthritis patients, they are better by warm applications, by heat, by local heat. But in guaiacum, they are relieved by cold applications. But sciatica pain is aggravated by heat in guaiacum. It is also a very good remedy in gout and rheumatism, pain in especially wrists. So rheumatism of wrists, we can think of guaiacum. ABROMA, ABROMA angusta. It's useful for easy conception. One specific therapeutics book says, ABROMA angusta mother tincture administered during the menses is said to bring on conception in young married women. I have used ABROMA in mother tincture forms, 10 drops twice daily. Usually the constitutional medicine indicated is sepia. That I give on the 5th day. 1 dose of sepia on the 5th day, maybe in 1 m or 10 m potency, followed by euphorinium 200 in the morning, folliculinum 200 at night to stimulate the ovulation. Along with that, I give this ABROMA mother tincture from the 5th day of menses for 21 days, 10 drops diluted in a cup of water. Very often it has helped me in infertility cases. URSI. It's the best urinary antiseptic. People who are on catheterization for a long time, bladder disorders due to cystitis, pyelitis, kidney stones, you think of this URSI. Agraphis nutans. It's one of the leading remedies for adenoids. As you know, adenoids is more common in children. Usually they say you take some antibiotics, Septilin, till the child grows, and when they grow, very often the problem disappears. But they usually come around 3 years to 5 years age. Here, adenoids is usually associated with enlarged tonsils. Because of the enlarged tonsils and adenoids, it gives a sort of back pressure on the eustachian tube. So the child is unable to hear. So that is called throat deafness. hearing capacity will be diminished due to enlarged tonsils and adenoids. So that time you can think of Agraphis nutans. These four medicines, Baryta carp, Calcarea fos, Agraphis, and tuberculinum, it can treat majority of cases of adenoids and tonsillitis. Very often you don't require, the pain is controlled by Baryta carp. Very often we have seen these adenoids and tonsillitis in a constitution of Calcarea fos, lean and thin children, very active, jumping here and there, with typical sweating on the scalp and desire for egg. So Calcarea fos, Baryta carp, tuberculinum, and Agraphis. These four medicine you can treat almost 99% cases of adenoids. Ricinus communis. It is useful in agalexia when there is lack of milk in nursing women. It increases the quantity of milk in nursing women. Few authors suggest use as an external application also. When used externally, developed milk, it may also be given internally in low potency.